Hello and welcome to Speak Up, Listen Up, Follow Up, the podcast from the National Guardian's Office. In this series, we're exploring the role leaders play in fostering a healthy speaking up culture and making speaking up business as usual. In our second episode, Dr. Jayne Chidgey-Clark, National Guardian for the NHS, speaks to Matthew Winn, National Director of Community Health at NHS England and a Chief Executive of Cambridgeshire Community Services NHS Trust. In this conversation, Matthew discusses how speaking up is part of the DNA of a working environment, and how data can be used to make an improvement within an organisation's speaking up culture.
Without a good culture where staff are supported, we are on a hiding to nothing.
We hope you enjoy this episode. Now, over to Jayne.
Welcome, Matthew, and can I just say thank you for taking the time to sit and talk with me as we discuss in our podcast the importance of freedom to speak up. And never, with all the high-profile reports currently around, has this been so important around what does freedom to speak up mean to you?
Thanks, Jane. Well, I'm delighted to speak on this because it's something very kind of close to my heart as a leader and close to, I think, how we've hopefully in my organisation, because I'm Chief Exec of an NHS Trust, but also I'm a National NHS Director as well, and in NHS England. And I think if I think about delivering healthcare, we can make freedom to speak up super complicated, or we can make it simple. And I like to make it simple. And freedom to speak up is about culture, and hence it's about good care and it's about safety. And you know, to try and bring the dots together in that. If we don't have good culture in our organisations, worse position to provide great and fabulous care to our local residents, whatever type of care we produce, whether we're in acute trust, primary care, dentistry, sexual health clinic, community nursing service, whatever it is. Without a good culture where staff are supported, we are on a hiding to nothing. The freedom to speak up approach is a really good litmus test about whether we've got our culture right and whether people are able to voice their concerns, are able to voice their anxieties, are able to say when things have gone wrong, are worried things are going to go wrong, and actually there is no repercussions on them as an individual. The organisations support them in any investigation, any approach, anything that needs to happen. But also we therefore learn from things and we view them as positive aspects in our culture as an organisation. And it's all those things to me. And you know, when I look at staff survey results, which I frankly think that we underuse in the NHS, they come out once a year and then they're quickly forgotten, aren't they? They're a really good. Is the culture right in our organisations? Are staff feeling secure? Are they staff feeling supported? And I think the way the National Guardian's Office over the last few years, and Henrietta prior to you, have really done well is to really shine a light on the linkage between great care being delivered and the ability for people to speak up and do that safely and well. And I know there's a really fundamental link between them. And it distresses me when people view it as a pocket in its own right. It is not its own thing. It is part of the DNA of any organisation. And that's the way we need to make sure our organisations are led.
That is such a helpful kick-off point for our conversation. It resonated that, part of the DNA of an organisation, and it absolutely freedom to speak up about what gets in the way of doing your job and potentially things that could go wrong or have gone wrong is absolutely crucial to that open culture that you've described. From our organisation's perspective, the good speak up culture, and you've said that it's in the round. It's people will speak up through different routes. They might talk to their line manager, they might speak to human resources, they might speak to you as the chief exec or one of your non-executive directors, or they might choose to speak to their Freedom to Speak Up guardian. And it's having a whole environment within which people are encouraged to know that their leaders want them, encourage them, need them to tell them what's going on. What's it really like around here? That's so key, isn't it? I'm just wondering, from your experience, have you either had to speak up in the past, and so what's that personal understanding of that, and has it gone well or has it not gone well? Just wondered if you wanted to share any of that.
Yeah, I'm personally, I've never had to speak up outside of the kind of normal line management, normal approaches to try and solve things at work. And I guess I'm probably in the minority in that respect, I guess. But certainly as a chief executive, I regularly have people raise things directly with me. Now, sometimes it's informal. When I'm out and about and they take me aside and, Matthew, can you just be aware of this? Sometimes it is formal, sometimes it's a formal whistle-blowing scenario, and those come in all the time. And I think my organisation has an approach whereby anything raised we treat underneath that confidential banner. So it goes on our Freedom to Speak Up register, and when people are raising concerns, especially about the standard of care or the way people are being treated in teams, that becomes, whether people ask for it or not, and immediately something our guardian is aware of will lead in the approach, because I think that's the right thing to do, because it means that we get to an outcome in a formalised way or informal-wise way, depending on what's needed. I stay abreast of anything that is raised with me. I don't always actively get involved in every mechanic of it, and I don't think that's the right thing to do, because being involved as a chief executive is a hard enough dynamic for some of our teams to deal with at the best of times. But actually, I trust our Freedom to Speak Up guardian to do the right thing every time. She has a executive director and a non-executive director who she will talk to seek advice and to give assurance that we are doing things resolved. And I think the role of me as the chief executive when people raise things is that I can formally go back to say, yeah, I've looked at this. And sometimes I think about a recent issue that was raised to me that we treated under this approach. The person wasn't satisfied, and it's not up to me to kind of judge the motives about why someone's bringing it. Actually, that's irrelevant. The fact that they need to and want to raise concerns about whatever they are raising, even if we as an organisation, even I as a person, sit there think, I think you might be wrong. Actually, that's irrelevant, because they have felt so strongly that they needed to bring it to my attention. And that's really the important thing, isn't it? That we listen to people and understand what they are really worried about and hopefully do something about it.
Absolutely, Matthew, and that's clear by your approach to this, is that it's not the why have you said it, and it's not the who has said it, it's the what are they raising, what's that telling us, and what should we do about it. I think it's fair to say with some of the recent high profile reports, that's not always the case everywhere. And I guess if there are leaders listening to what your workers are saying to you is a gift. And as you say, even if once it's been investigated, there's nothing that does need changing, and sometimes that will be the case. It might just be one person's point of view, but very often there is something in there that does need addressing, and if it's addressed and then the person is fed back to, and it's something that people do, and it's something that people can really hear from their leaders, we take this seriously and we do something about it. So I wondered if there are particular ways within your organisation that you feed back. How do you encourage your staff to know that it really is safe to speak up in your organisation?
I've thought about this, and probably what I'm going to say is, frankly, a little bit motherhood and apple pie, but it doesn't mean it's wrong. Because actually, when I said at the beginning, Freedom to Speak Up is about culture. You create culture through studies, and culture doesn't happen overnight. I remember many years ago, a chief executive emailed me, and we had a conversation saying, look, I've looked at your staff survey results, etc., and I'm not long at my trust, and we've got a CQC inspection soon. What do you suggest I do to make improvements? And I said flippantly, but absolutely truthfully, you should have started 2 years ago, because you don't do things in 6 weeks before you have an inspection, because that's bound to be really odd. That's bound to be really odd. And my point being, this takes time. It takes time to create culture. It takes time to foster culture, good culture, and it takes time and energy to carry on with a good culture. So, for instance, I go to induction for new members of staff, and on the rare occasion I can't be there, my great deputy Anita is always there. One of us is always there, and we always talk about values, we talk about behaviour, we talk about culture. We always mention our freedom to speak up guardians, speak up champions, where we have 20, 30 of those out and about, and we talk about civility, and we talk about bullying, we talk about harassment, and we talk about how we need them from the very beginning of their employment in our organisation to be telling us if things are going wrong, and we are going wrong. And we absolutely underline that if things are going wrong and they can't talk about it locally, we want to hear about it. You do not need permission to email the chief executive. You do not need permission to talk to the director of HR and workforce. So I just say that as an indication. We always write welcome letters to people. We have worked really hard at our employment practices, where we're welcoming how people come into the organisation and make sure that we're feeding back. We have worked really hard and long on leadership development, not at very junior kind of management, senior, and indeed those that don't even have a managerial role. Lots of that is about people's personal impact, how they can be a compassionate leader. Using Michael West's work has really focused on that, about actually it's not about status, it's individuals to make a difference in the lives of our staff. So Jayne, it's all of those things plus a lot more. That's, for me, again, sounds all very mother and apple pie-ish, but it's all about creating a culture whereby we value our staff, we focus on the right things, which is frankly the only reason we're here. Whatever role we've got in the organisation is to provide great care to our local residents. Doesn't matter whether you're a finance person, an administration person, a clinician, we're all here to do the same thing. And therefore, it's quite an easy step to actually then start to talk about actually that reliant on people being honest, challenging, but also responding to people that want to raise concerns and then doing something about it.
Absolutely,
so it's all of that. It's all of that and more.
Though, and to me, it doesn't sound motherhood and apple pie. What it sounds is the foundations for building a good culture. And if listeners think that's too simplistic, I think what you're reminding us from leading a successful organisation is actually these are the building blocks, and they need attention every day. It's not something that you do on an away day and have nice posters around your facilities. It's got to be worked at every day, because every day it doesn't sound simplistic to me. It sounds like the fundamentals, and I think we as leaders need reminding of what those fundamentals are, because if there was a quick fix solution, we would have got it by now. We know we haven't across all organisations. So I wondered if you've got any thoughts on if there are any particular levers, for example, data or anything that you use to help drive that improvement in culture. Any particular levers that you use in your organisation?
Well, I think that's an interesting kind of challenge, and I've been thinking about the use of data in this space, but not just the freedom to speak up data. It's using all the data, so again, from pulse surveys, from staff survey results, triangulating that with the complaints that are coming in and the incidents and the sickness levels, short-term sickness levels in our teams, and saying, actually, Actually, does all this then give us a view of what that kind of microcosm, that kind of local climate is in that local team? Because the downside of looking at our data sometimes, it's easy to skim over the surface and look, well, within 4,500 people, 5,000 people, actually this, I could easily do that in my organisation. Say, look, my staff survey results are some of the best in class. I've been at the top of the Freedom to Speak Up league for when it was published for the first 3 years. That's irrelevant. Actually, I need to understand what's happening in the localities and what I'm doing. And that for me is what we ask our team leads to do and our service director, really get underneath the skin of it. If there are some pressing issues, then that's a point where we look for other resources, some of the corporate resource, some of the OD, some of the external resources we can bring to a team to say, how can we support you to get better culture, better style, better approach in what you're doing, of which listening to people is clearly one of the most important aspects.
Yeah, Matthew, that's so important, isn't it? And that data triangulation is absolutely key. And I'm very clear that the Freedom to Speak Up Guardian route for raising matters is only one of many, because there's never when Sir Robert set up the Freedom to Speak Up Guardian role, an idea that everything would come through that route. So you need to triangulate all the different routes where people want and need to appropriately raise the matters that are important to them. So that's really absolutely key. Matthew, I was talking with a board of an organisation, an NHS organisation, not very long ago, and they were absolutely saying what you were, which is we can't be complacent. We have, a good CQC rating. We have, good staff survey rating overall around the Freedom to Speak Up elements and some confidence, but it's not perfect. If 30% of our organisation still don't feel safe to speak up, of those who responded, and maybe those that didn't respond don't feel safe, what are we doing? And they were saying absolutely like you, that it's not enough to look at an aggregate as a good or excellent organisation. We need to be looking at individual areas, out over there. How are our services that work overnight? Are all workers feeling? So it was really encouraging to hear you saying that. And I think there's going to be a real opportunity with the new NHS Freedom to Speak Up policy and guidance that will be published soon, for boards and organisations to do a stock check, almost a reset. Where are we at? What's working well, and what do we need to do more across all areas of the organisation? So it's really good to hear you say that. Thank you. Can I ask, as a close to our fascinating conversation, and thank you so much for taking the time, can I ask, what's your Speak Up pledge?
I think the Speak Up pledge, and I think this is really important, not just because I must, and we as leaders must keep a focus on maintaining the momentum behind the Freedom to Speak Up approach and support of our guardians. And again, that sounds really simplistic, but it's really important that they're not sidelined. It's really important they're not viewed as important, and it's really important that we don't say actually they're a nice to have and therefore we can do without them. So our pledge as leaders must be to support the approach. What's challenged me is that question on data. Can we evidence that actually we've looked at all the forms of our data to understand the culture, what our staff are telling us, and really have robust ways to do it? And I will think about that with the team, to think about actually their ways of doing it. We have a leadership forum in a couple of weeks' time when we always bring together our leaders, and that may well be a good conversation to have with them about how can we do that in an even better way.
Thank you so much, Matthew, and I hope we can continue this dialogue in the future, to hear from your learning and your encouragement. Thank you so much.
Thanks.
Thank you so much, Matthew, for taking the time to come on our podcast. Thank you for listening, and I hope you've enjoyed this episode. Next time, Jayne will be joined by the Director of Equalities and Inclusion at NHS England and Improvement, and the Chair of the NHS Dorset Integrated Care Board, Jenny Douglas-Todd.
All of us have a responsibility to be speaking with truth, with care, with dignity to each other.
Make sure you subscribe so you never miss an episode. We welcome your feedback, so please like, rate and comment. Thanks for listening.